We're going into the third wave already very, very exhausted and tired. We are losing staff, and that's going to be the biggest challenge.
You can have capacity. What if you don't have nurses? What if you don't have doctors?
This is the scene inside Toronto's Humber River Hospital in the throes of the third wave of the pandemic. ICU beds are full, patients are younger and sicker, and the staff are being pushed to their limits.
I'm very concerned where we're headed. Our capacity to continue on like this.
The pandemic has taken such a toll on healthcare workers that some are leaving the profession they once loved and dedicated their lives to. And as cases of COVID-19 swell again, straining hospitals across the country, the staff that are left are tired and struggling to keep up.
At the beginning of the pandemic, everybody was ready and willing. I remember getting so many emails saying, hey, I'm ready to come in, I'm ready to come and help. I don't get any emails like that anymore.
Dr. Nisha Bakshi is the internal medicine lead at the Royal Alexandra Hospital in Edmonton. She's also in charge of the hospital's COVID response.
Everybody's tired of it. It's exhausting to work on the COVID unit. You are there for a 10-hour shift. You're wearing your full PPE. Right now, I think that we're seeing so many young patients come in that there's some moral injury and emotional burnout.
So just finishing up shift today on the COVID unit. We're starting to see our hospitalizations climb steadily. We're tired, we're battle worn, but we will continue to show up.
Dr. Bakshi actually holds the record for the most days spent on the COVID ward at her hospital.
It's come at a cost. It's come at a mental health cost, as a physical cost. Within the medical field, and particularly with physicians, I think it's still viewed as a sign of weakness, that if I admit that I'm depressed or anxious or have PTSD, it must mean that I cannot do my job.
In January, Dr. Bakshi, who's also a mother of 2 young children, was diagnosed with post-traumatic stress disorder, or PTSD. It's a mental health condition that can occur after a person experiences or witnesses a traumatic event.
And so December, I describe it as chaos. It was just chaos. There was new patients all the time. There were patients crashing all the time. And I noticed that I was having difficulty sleeping. I was having a lot of nightmares. I was reliving and replaying conversations I had with families. I think that was probably the biggest thing that hit me. I didn't care if I showed up or not. And I knew that that was not like me. But I think what really did it was my husband. My husband said to me, he said, you're not yourself. You're angry, you're taking things out on us. And I know that you've been through a lot and maybe it's time to get some help. And that was it.
She got help and has been seeing a counselor since.
I'm a pretty resilient person. I have, I think, fantastic coping skills, but even myself, I was tested. I was put at a limit that I couldn't sustain.
And it's not just physicians who are experiencing this. The vast majority of all healthcare workers reported worsening mental health during the pandemic, according to Statistics Canada. And among workers who had direct contact with patients who may be sick with COVID, that number is even higher.
There's always a nurse there, and that's pretty unique to our profession. Like 24/7, day and night, 365. If you're in a hospital, a nurse is there. Nurses provide the bulk and the majority of patient care.
Danica McPherson has worked as an ICU nurse in Toronto for 8 years. Right now, she's treating patients with COVID-19, while also studying to become a nurse practitioner.
As you step into a COVID positive room, I don't even know how to describe that to somebody. You just have this silent prayer that you throw up to the God, and you're like, I hope this PPE is on properly and working. And then you just walk in that room and you just have to trust that everything is fine.
Even before the pandemic, nurses' stress levels and workloads were high. A 2019 Canadian study found that nurses experience widespread and severe symptoms of PTSD, anxiety, depression, burnout, and suicidal behavior at a rate higher than the general population. And now the pandemic has exacerbated things. Workloads have increased, and nurses are being pushed to their breaking point.
You feel tired and depleted, and you're just wondering when the end is coming. Is it gonna come?
Birgit Umagba is also an ICU nurse. She says she's exhausted and burnt out, and it's starting to impact her relationship with her 9-year-old daughter.
I just feel this weakness, and A lot of times I can't even play with her. I'm like, I'm tired, I need to recover, my feet hurt, my legs hurt, my muscles hurt, my neck hurts. So everywhere hurts. It's more like a chronic situation at this point. But I'm just really mentally drained.
Birgit says a month ago, she started having nightmares and trouble sleeping. And she says it's not just her. Her colleagues are experiencing the same thing.
The amount of dead people we see, right? And also the cold blues, the chaos is really affecting a lot of people.
She says more needs to be done for nurses. Reduced workloads, counseling, increased sick pay and wages, and stronger public health measures would give nurses incentives to stay.
We also think that this could have been avoided. So with all of that, it's just put so much burden on us, and people are asking, what's the point?
The turnover of nurses was a major problem before the pandemic. It's estimated 1 in 5 nurses left the profession every year, and the pandemic has accelerated this.
We joke and say we wish we could split ourselves into like 2 or 3 people to get our work done, but it's not possible. It's very hard to stay in a profession where you have very hard workloads and you're feeling that ethical or moral distress that you're not able to deliver optimal or the best care.
And as hospitals across the country ramp up their capacity, adding new ICU beds to deal with the latest surge of COVID cases, some provinces like hard-hit Ontario are searching for thousands of nurses. There's also a shortage of personal support workers.
It's rampant right now. A lot of PSWs are leaving the field, a field that we once loved and dedicated our lives to.
Sharon Tonner-Clarkson has been a PSW for nearly a decade. She works in palliative care in Toronto. She kept going to work amid COVID outbreaks and scares, colleagues getting sick, daily stress, and constant rule changes. She showed up until she couldn't. She's now off on stress leave without pay.
It's been really emotional. There's been days where you spend time in your car at lunch just to get your mask off and you're crying because you're totally frustrated.
Was there a final straw for you, a moment where you thought, I just can't do it anymore?
There was my last day before I went off on my leave, and I felt like the walls were caving in. We were short-staffed. I left in tears that day, absolute tears, bawling, and just walked right out. You know, I have pretty broad shoulders. I've been doing this type of work for a very long time, but this whole pandemic and this whole situation has just really broke me.
Do you think you'll go back to work?
Sadly, I may not go back to what I was once doing and loving.
Where are you seeing the most shortages?
Everywhere. If we don't really address health human resource situation, our system is going to fall apart.
Abby Sriharan is a professor at the University of Toronto who studies burnout in the medical field.
So the studies pre-pandemic have shown 50 to 60% of health workforce was experiencing burnout. But the pandemic has actually increased that rate.
Although burnout itself is not technically a medical condition, it can cause depression, anxiety, and fatigue, which can lead to feelings of numbness, anger, and guilt. Physically, it can cause high cholesterol, diabetes, heart disease, and various other illnesses that can shorten a person's lifespan.
So people go on stress leaves, right? And you are now not in that environment that's triggering the stress and burnout. So you will feel better, you go back, and it's going to happen again. Unless we address the working conditions and how people are compensated and what type of incentives are there to keep them in the workforce, we are not going to see any changes.
In every facet of Canada's healthcare system, people are leaving their jobs. Others are sticking it out until the end of the pandemic out of loyalty for their colleagues and patients. But as soon as it's over, some say they'll also walk away. The fear is there could be a mass exodus among Canada's healthcare workers, impacting the entire system for years to come. How worried are you about hospitals' capacity to treat people during the third wave and into the future?
Acutely right now, I'm very worried, and I don't think we're going to be able to ignore all of the non-COVID patients coming in. They're very sick, they're going to need care, and that's going to translate into a system that cannot keep up.
It's been more than a year of showing up when they were called, working long hours in PPE until their whole body ached, setting up video calls so families can say final goodbyes. They cried with them, slept a few hours, and did it all over again. And now, with no end in sight, how will they manage this punishing third wave?
It's no secret that healthcare workers are resilient. Does that make you hopeful?
It does. It also makes me feel sad because I think there's an expectation that we are resilient. And it comes back to that stigma of mental health in medicine, that, you know, this is what we were trained for. We deal with life and death. But I think that there is a limit to how much we should be expecting from healthcare workers. Because right now, I can tell you that most people are not resilient. Most people are still just surviving. I think resiliency is probably at an all-time low.